Hello everyone, I'm Dr. Saurabh Joshi from the Vein Center. Today I'm going to tell you something about a very important incident that can happen with a patient with varicose vein. It might have already happened or somebody who you know might have experienced this. It is called rupture and bleeding from a varicose vein. What to do when a vein bursts? Now it is a common occurrence that these bulging veins uh, can burst and bleed, and whenever this bursts, this is a lot of bleeding, and it can look like a fountain of blood. And this is a very what do you say, a frightening sight, where if you're seeing this, if you are experiencing it yourself, or a loved one is getting out of the blue a lot of bleeding and they're standing in a pool of blood, you are bewildered, and you don't really know what to do. And for 5 minutes we are just uh, they caught rabbit in the headlights. We don't know what to do, and while this bleeding keeps on happening. So if such a thing happens, the first thing is just try to remain calm, see where it is bleeding. Don't try to run around to find some right medication or ointment. Just catch the part which is bleeding, make the patient lie down, elevate the legs a little bit, and press where it is bleeding. Okay, first press it, and then you can elevate it and hold it like that for 5 minutes. Don't remove your hand, just press it tightly. You can use a clean towel, or if you have a first aid kit nearby, sterile gauze or cotton, and hold it and press it like that. Hold it for 5 minutes, and if you elevate the legs with a couple of pillows, it should stop. And once it stops, don't leave it without any pressure. Do a pressure dressing. Uh, do a dressing with tight compression on it, and leave it always having a tight dressing. You don't remove the dressing. Let pressure be on it, and don't remove this until you see a doctor, a nearby doctor, or if you happen to be nearby, come and see us. uh, Varicose veins needs to be treated, but the acute emergency of bleeding needs to be dealt with, uh, and very quickly. We can't have bleeding going on for 15-20 minutes, and then it stops on its own. It's going to stop after a very long time if you just let it bleed. You need to hold it, you need to put pressure on it and elevate the legs. Why am I telling you this? It might sound obvious. It is bleeding, so obviously I'm going to hold it. But in that point of time where either yourself or a loved one is having a lot of bleeding, we get scared. And if it happens to me, I'll get scared. And I would want to have this information that remain calm, apply pressure, elevate the legs, and this will stop the acute phase of bleeding. But once bled, the burst vein is very likely to bleed again. So in the near term, it needs to be treated. We need to treat and close the varicose vein. But until you treat, don't remove pressure from it. Don't leave it just like that. Now the if you see that bleeding has stopped in 5 minutes, and yeah, it stopped, so I'll just let it go. No, it'll bleed again. You need to maintain pressure on it. Go to a doctor, so that they do a proper pressure dressing, and then plan on getting this treated, because it would keep bleeding until at regular episodes, until you do something for varicose veins. Again, to sum it up, if that's an acute episode of bleeding from a varicose veins, uh, put pressure on it. Don't first try to search for an antibiotic ointment or turmeric or any of such. Just put pressure. Put pressure with your hand. Just hold it tight. Put pressure around the whole area, and just hold it tight, and let the patient lie down, elevate the legs a little bit. And once the bleeding is controlled or stopped, then you put a tight dressing and let the patient elevate the legs and rest. uh, that's what I wanted to share. This bleeding varicosities, I mean, I realize that there are a lot of patients who suffer from this, and they don't know what to do in an acute episode. Yes, you have to treat the varicose veins later on, whichever ways you want to treat. But it is life saving to stop such a lot of bleeding. You need to stop the bleeding so that the patient, your loved one, doesn't lose a lot of blood. Yeah. Thank you. Thank you.